Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. This channel is for everybody. This channel is for medical students, medical professors, doctors, patients, and the common man also. So I request all the well-wishers of Ayurveda, all the well-wishers of the health, they can see each and every video of mine and they will be definitely get a good knowledge in a very simple language. Very simple language. Any common man also can understand. Don't worry, be happy. Okay. So, as you know, myself is MD in Ayurvedic medicine, that is Kaya Chikitsa, and MD in Ayurvedic physiology. So, double post graduation. Okay. Anybody wants any type of consultation, gynec consultation, pediatric, children, old people, cancer, whatever, diabetes, bronchial asthma, this and that. I have the full team of the doctors. So only you are requested to WhatsApp me on 9226810630. Today is a subject of, yes, striroga, that is a gynaecology, that is the problem related with the woman or the women. Okay, so this is very important. The topic is related with the pregnancy. Again, we are going back to the paper 1. I know there are paper 2 and paper 1 is related with prasutitantra, that is delivery, pregnancy. And this topic is very, very important for the people who have just married, the ladies having the pregnancy. They must hear this video very carefully because this today's topic is related with pregnancy complication. Please try to understand pregnancy complication, and we should be able, we should know what are the causes, how we can prevent it, when to go to the doctor. So the topic name is, here you can see, I will go slowly and steadily for you. See, here I am marking this topic for today. Antepartum hemorrhage. For the students, this topic is very important for the examination. Always, a lot of questions are there. APH. Please write down the short form. A, P, and H. That is, here you can see antepartum hemorrhage. Before the 9th month and 9th day. To complete delivery, this is before the pregnancy, there is some bleeding. Hemorrhage is a bleeding, and that is serious. Is not very easy. You must, pregnant woman must go to the doctor in the hospital where she has registered her name for the pregnancy or the delivery. Antepartum hemorrhage. Anti means before. There is also one topic that maybe we will discuss in the next lecture. Yes, very interesting. That is PPH, postpartum hemorrhage. This today, antepartum hemorrhage. So two topics are very important. APH, PPH. APH, PPH. Antepartum hemorrhage, postpartum hemorrhage. Let us see what is the definition. This is the bleeding from or into genital tract. That means the uterus, cervix, vagina, etc. Okay? Bleeding in the genital tract after 28 week of pregnancy. That means after 7 months, but before the birth of baby. Now let us see what are the causes. First, 70% bleeding is related with the placenta. You know, the placenta is a membrane in between, connection in between baby and mother, connected with the umbilical cord through the placenta. So placenta is in between baby and mother. So there is a problem with the placenta, that is called as a placental bleeding, 70%. Then there are some chances extra placental, not related with the placenta, extra placental, only 5%. And unfortunately, there is no reason, unexplained. Can you see? 25%, we can't find any reason, no reason. But bleeding is there, serious. It's very serious condition. Now, placental bleeding. I request all my students to write down the causes of APH. Please write down 3 important causes: placental bleeding, unexplained bleeding, and extra placental bleeding. So keep this word placenta, placenta, placenta here. And then there are 2 abnormalities of the placenta, that is placenta previa and abruptio placenta. These words are very important for the APH. So write down, I will wait for you, placenta previa and abruptio placenta. 35%, 35%. Placenta previa, abruptio placenta. Placenta previa, abruptio placenta. These words must be remembered. Oral also they will ask you. Now there are also causes: local, cervico-vaginal lesion. There may be cervical polyp. There may be carcinoma of cervix. There may be varicose veins, or there may be local trauma at that part. Okay, so let us move further. Slowly I will go up, and now we will see one by one. Placenta previa. This is the first problem for the APH, antepartum haemorrhage. Placenta previa, big cause, important cause. Placenta previa is an uncommon pregnancy complication. That means very few ladies will have this problem. So don't take tension, because some ladies are seeing this video. Oh my God, sir, what is this problem? Be happy, be comfortable. Your doctor will take care. But at least you should be aware of that. This is very rare complication in which placenta has attached to the uterine wall close to or covering the cervix. You know, the cervix is like a mouth of the uterus. Cervix is a part like a mouth of the uterus. So this is a bag. Your uterus is a bag, and here you can see here. This is cervix. This is uterus. This is cervix. So that placenta is attached near over here. We have the pictures. We have the pictures. Don't worry. Okay. So placenta has attached to the uterine wall close to or covering the cervix. That can causes excessive bleeding in the later part of first trimester. You know, there are 3 trimesters: 3 month, 3 month, 3 month. First trimester, second trimester, third trimester. Trimester means 3 month. 3 plus 3 plus 3, 9. 9-month pregnancy. Okay. But usually during the second or third, that can cause bleeding. It is a leading cause or important reason for antepartum hemorrhage, that is vaginal bleeding before delivery. Vaginal bleeding before delivery. Let us move further. Okay. We will describe how it is. We will see what are the symptoms. Just wait till the Dr. Deshpande make a very attractive marking for you. Now you can concentrate on these lines. Placenta previa is a painless bleeding. Very important feature. Otherwise, we think, oh, there may be a lot of pain in the lower abdomen, in the uterus. No. Painless bleeding, that is dangerous, because the lady even don't understand what is going on. So painless bleeding, and due to the implantation of the placenta in the lower part of uterus near to the internal cervical os, it can cause serious morbidity. That is the problem with the fetus, baby, problem with the mother, and sometimes death. Mortality is a death to both. Maybe problem with the baby, maybe problem with the mother. So this should be taken very immediately action and go to the hospital. Okay. Let us see what are the causes for this placenta previa. Here are the causes. Before pregnancy, there may be uterine injury, trauma. Then there may be prior, that means before, induced abortion. Not in this pregnancy, before. Post-coital trauma. There is no mind control, and some couples, they enjoy the sex, and during the sexual activity, after sex, after intercourse, this may like a trauma and bleeding starts. So be careful. Okay, at least first trimester and the last trimester, there should not be intercourse. Remember this fact. Okay, then another reasons for placenta previa, here you can see. First, subsequent pregnancy following by cesarean delivery. So there may be cesarean section before, and then this pregnancy has taken place. There may be previous uterine surgeries for the fibroid, for the DNC, dilatation and curettage, for the excessive menstrual periods, DUB, dysfunctional uterine bleeding, menorrhagia, polymenorrhea, metrorrhagia, polymenorrhea. These are the different bleeding problems, menstrual problems. So minor surgeries may be there. Then what is the risk factor? Placenta previa. Why this is happening? Let us see what are the reasons for placenta previa. So these are the risk factor. Previous placenta previa, history of placenta previa, same incidence in the before, in that particular life of the lady. Caesarean delivery before, there may be history of abortion, history of caesarean section, history of previous same antepartum hemorrhage history. Then women who have had previous pregnancies, especially large number of closely spaced pregnancy. That means there is a very less distance in between first pregnancy, second pregnancy. Immediately after 1 year, immediately after 1.5 years. So this is a frequent. Ideally, there should be a distance of 3 to 4 years. But these are the repeated pregnancy that can be the risk factor for the bleeding. For the bleeding, women younger than 20 are higher risk, and women older than 30 are at increasing risk as they get older. That means above 35, more risk. Above 40, much more risk. So the normal pregnancy should be in between the year, say for example, 22 to 30. This is the right age to get pregnant. Not too early and not too late. Women with a large placenta, because of the twins, inside there are two babies, twins, or there may be Rh negativity incompatibility. One lecture I have already taken, erythroblastosis fetalis. The child is having the positive Rh positive, mother is Rh negative. There, this type of some incidence occurs. Then the lady may be taking some infertility treatment, Vandyatva chikitsa. There may be, the patient may be poor lady, low socio-economic status. We are discussing placenta previa risk factors. Low socio-economic status, short inter-pregnancy interval. Just now I have mentioned, distance between the two pregnancies should be ideally 3 to 4 years. But here, repeated after every year, risk factor APH, antepartum hemorrhage will take place. Placenta previa. Okay. So, another reasons, multiparity. Can you see it? Multiparity. 5% in the grand multiparous patients. Other causes include digital examination with the fingers. Then abruption, that is preeclampsia. Preeclampsia. For example, in the urine, there will be albumin. The patient, they have the lady, pregnant lady, has the hypertension, albumin in the urine, and sometimes little bit convulsions. So together it is called as a preeclampsia. It's very toxic condition. Okay, chronic hypertension. That pregnant lady may be having high BP. Other causes, trauma, that is post-coital trauma. We have discussed first and last trimester, no intercourse. Okay, risk of the placenta previa. Okay, what are the problems? Risk of placenta previa. This is a main reason for we are discussing APH, antepartum hemorrhage. antepartum hemorrhage, before delivery, vaginal bleeding. The main reason is placenta previa. Problem with the placenta. The greatest risk of placenta previa is causes less pain, less bleeding, painless, no pain, leading to the morbidity, that is disabilities or death, mortality to mother or to the baby. Who are having this problem or risk more? Abnormal implantation of placenta, sticking of placenta at the lower border of the uterus, covering the os, cervical os, retarded fetal growth. The baby is not growing according to the gestational period. Second month, this much. Third month, this much. Fourth month, this much height and weight. This much may be the heart sound. No proper growth. Birth defects in the baby. Then infection after the previous delivery. So these are the different causes. Now you can see the classification of placenta previa. Can you see here placenta? This is the placenta. Can you see here the cervix? Can you see my cursor? I will just a moment, I understand. What is your problem? I will understand. I will explain. Yes. Now very colorful picture. Can you see now my cursor? Here is a cursor. Black. Can you see? Here. Placenta. Here. Can you see? Here also. It is coming like this is cervix. This is uterus. This is inside is a baby. This is umbilical cord. But this is a placenta. And some here always nearly complete covering the cervix. Now just see below. Can you see here? Here the name is a placenta. Can you see placenta? Here also, can you see my cursor? Please see my cursor. This is placenta. This is also placenta, my dear friends. And this is also whole covering the placenta, total covering. Okay. So these are the names. These are the names. We are discussing the topic antepartum hemorrhage, bleeding before pregnancy. APH. APH. Placenta previa is the main cause. And these are the classification of placenta previa. Low lying. The name is low lying. This is marginal. This is partial. This is cervix. The mouth of the uterus. Mouth of the uterus. And this is totally covering. Low lying. Marginal. Partial. Complete. I'm sorry. Complete. Low lying. Marginal. Partial and complete. Classification of placenta previa. Most important 35% cause of APH, antepartum hemorrhage. Okay. Let us see the types of placenta previa. Just wait for a few minutes only. Type 1 or low lying. The major part of the placenta is attached to the upper segment of the uterus. Only the lower margin encroaches on the lower segment, but not to the internal os. Up to the cervix, no, it is up. It is up. It is stick to the uterine wall. In this variation, the edge of the placenta is near the internal, but does not reach to the total cervix. Type 2 or the marginal placenta previa occurs when the placenta is at the margin of the internal os, but does not cover it. Type 3 or partial placenta previa. Most important reason for APH, antepartum hemorrhage, occurs when the internal os is partially covered by placenta, covers the internal os when closed, but does not entirely do so when it is fully dilated. We are talking about cervix, mouth of the uterus. Okay. Type 4 or the complete placenta is covering totally to the internal cervical os, is completely covered by the placenta. We are discussing now the symptoms of placenta. Okay. Slowly and steadily. Placenta previa. My dear friends, we are discussing placenta previa, cause of APH. Symptoms: painless, causeless, recurrent and sudden onset of vaginal bleeding. The bleeding is associated with pain. When. This when is important. Labor starts simultaneously. That is labor pain. But originally placenta previa, no pain. But if it is together, delivery starts, then there will be labor pain or the spasms in the lower abdomen. Sign. Symptom means what the patient is telling. And sign means what the doctor is examining and his findings. Doctor's findings are signs. Patient's complaints are symptoms. Are you getting the difference? Symptoms with the patient. Signs, what doctor is examining and findings. Per abdomen, size of the uterus is appropriate to the period of gestation. That means if the 7 months have completed, it will look, the abdominal girth will come to the near about chest region. That is 7 months. It is parallel to the gestational period. Then uterus feels, just doctor is palpating, relaxed, soft, elastic, without any tenderness. You know what is tenderness? In Ayurveda, it is called as a sparsha sahatva. When the doctor tried to touch, patient say, oh doctor, don't touch. That is tenderness. Next, we are discussing the signs of placenta previa. Can you see here? Fetal head is floating at the near the lower abdomen. Persistent of malpresentation. There may be breech presentation. There may be transverse lie. These are the abnormal. Normally hair should come down, but here there is a back at the cervical part. So breech presentation, transverse lie or unstable lie. Fetal heart sounds are present. Per vaginal only. Try to understand. Vulval inspection should be done. No fingering. Per vaginal, no digital examination, finger examination. The blood will be bright red. Now, internal PV is contraindicated, very IMP. Can you see here, my dear friends? I have mentioned, we are discussing antepartum hemorrhage. There is already bleeding. And why you are disturbing by putting the hands? No, not allowed. So, internal per vaginal examination is contraindicated. My dear friends, whenever I start to discuss any clinical examination, I remember my mobile app. Yes, Dr. Deshpande has a YouTube channel, Ayurveda Academy, but mobile app, Google Play Store, yes, Ayurveda Academy app. Sorry, Ayurveda Academy, the name of the app is there. Free download, free, immediately. Now download it. Download it. There are nearly 10 to 15 programs. One of the program, very cheap. Because whatever the material, study material, whatever the PPTs, PDF, I am putting there. Just take it, my dear friends. Only 200 rupees, 300, 400, maximum 400, 500, nothing more than that. So you purchase it. Clinical examination. There I have central nervous system, respiratory system, cardiovascular system, everything is ENT, gynec, everything. You must purchase. This is my request. I am not making compulsion. Who am I to compel you? But purchase it. Very enjoyable. Study will be best. Okay. Internal PV is contraindicated. Confirmation, how we can do? Sonography. Now this is a non-invasive technique. No worry, be happy. There is no pain, there is no pricking. Only sonography. Only sonography. No X-ray like side effects, nothing. There is a trans-abdominal USG you can perform or trans-vaginal USG ultrasonography. Doctor can suggest. Color Doppler flow study also can be done. Okay, so naturally you will find out the position of each part. Differential diagnosis. We are discussing placenta previa. Now we will continue afterward, after completing this, Abruptio placenta. Then vas previa, the local cervical lesions. This is printing mistake. I'm sorry. Lesions, Lesions, some problem in the cervix. Now let us see what are the complications of APH, antepartum hemorrhage. What can be happen? Simple. During the pregnancy, APH can give shock. What is shock, sir? Shock is a less blood supply to the brain. Cold and clammy hands. Sweating will be there. Pulse will be feeble, but tachycardia will be there. So these are the some important features of shock. Okay. Then malpresentation, that fetus will not come through the head. Premature labor can occur. During the labor, there will be early rupture of membrane. There may be umbilical cord prolapse, coming out, prolapse. Then intrapartum hemorrhage during the delivery, slow dilatation of cervix, and by chance there may be some part of the placenta remain inside, retain the placenta in the uterus or inside. During the puerperial, that means after delivery, by chance, if delivery takes place, everything is okay. But after pregnancy, after delivery, there may be infection, that is sepsis. There may be subinvolution of the uterus. There may be embolism, and then embolism can go anywhere. It can be heart attack, it can be brain attack, anything can happen. For the fetal, what can be the problem? Complications, can you see? Low birth weight baby because of the placenta previa, because of this bleeding. Then there may be asphyxia. You have learned that in the pediatrics, neonatal resuscitation. So he will require some oxygen. Asphyxia. Intrauterine death, bad luck, that can happen. Birth injuries can happen. And congenital malformations also can happen during as a complication of placenta previa. 35% contribution for the cause of APH, antepartum hemorrhage, vaginal bleeding before delivery. Getting point? Placenta, understand? Okay. Now we will discuss about treatment part, my dear friends. Treatment for the placenta previa. Complete bed rest. Assessment of the blood loss. How much is the blood loss? Is a mild, it's a moderate, or it's a severe? So just be ready about the BT, blood transfusion, blood group, cross matching. Everything should be very hurried. Facility of caesarean section. So take the lady with this APH to the hospital where there is an expert team of the doctors who can perform caesarean immediately. Caesarean section, C-section. Facility for CS, vaginal examination in the operation theatre followed by caesarean section. Now we are going to see the next important cause, 35% of the APH, antepartum hemorrhage, vaginal bleeding before delivery. Second cause, that is abruptio placenta. Abruptio placenta. First was placenta previa. Now abruptio placenta. Say 10 times. Placenta previa, abruptio placenta, placenta previa, abruptio placenta, placenta previa, abruptio placenta. Sir. No, I am a teacher, so I must hammer these points in the mind of you so that you will not forget antepartum hemorrhage. Okay, so it is one of the cause of APH where the bleeding occurs due to separation, premature separation of normally situated placenta. In the placenta previa, placenta is attached wrongly. Here placenta is at the correct place. No problem, not at all. But it separates before expected time, that is abrupt bleeding, all of a sudden, abruptio placenta. Like for example, this is the uterine inner wall and this is the placenta. It starts coming out, and so here the blood vessels and they start bleeding. Okay, so here you can see the varieties. For example, can you see here? This is apparent. Can you see the bleeding over here? This is baby, this is the uterus, this is the cervix. Here also you can see concealed. Actually, here the bleeding is out. So apparent bleeding, you can see that bleeding. But here externally there is a very, very trace bleeding, but all the bleeding is concealed inside, hidden inside. Concealed is hidden. One in one part there will be bleeding outside that we everybody, the lady, relatives, doctor can observe, doctor can see. But in the concealed there is bleeding inside and it is not seen outside as a major part. Okay, concealed bleeding. And then here you can see relatively concealed. That means some part is hidden but some part is coming out. So once again repeat: apparent, concealed, and relatively concealed. Okay, so let us see. Let us describe these points in the words. That means we have seen the pictures, but what they are exactly: abruptio placenta. Abruptio, the cause of APH, antepartum hemorrhage. Revealed: blood comes out of cervical canal due to separation of placenta, and blood can seen externally, so no problem to diagnosis. Concealed: the blood collects behind the separated placenta in or in between membranes and the decidua, that uterine whole preparation for the baby, where the umbilical cord is there and all the nutrition is going, circulating mother and fetus. Mixed type, it is a type some part of the blood collects inside and some part is expelled out through the vagina. Okay. What are the causes? Why this placenta is separated from the uterine wall? Number one, advanced age of the mother. That's why this is a kind request to all the viewers. Any young couple is in your house, of course, that is their own choice. I'm not saying you should violate the personal independence, but my guidance to directly to the new couples, that proper time for pregnancy without any complications statistically proven is in between age of 22 to 30. It should not be too early or it should not be after 35, after 45. The statistically, I'm not saying every lady will get the problem. Dr. Deshpande is not saying that if you marry at the 40, oh, you are getting the problem. No, 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 no. I'm not afraiding you. I'm not criticizing your decision. I'm just mentioning what the medical science is telling, that when the pregnancy takes place after the, compared to the lady, I'm talking about lady, the wife, if the age is above 35, chances of complications are there. I have not mentioned that there will be 100% complication. Not at all. You do not afraid. There are now technologically, we are very strong. India is very strong. So don't worry. But you should go to the expert doctor and do the pregnancy registration and also the delivery, all the things over there. But this is the advanced age can be the cause of antepartum hemorrhage. Hypertension in the pregnancy. Everybody knows normal blood pressure. 120/80 mm of Hg. 120 systolic, 80 is a diastolic. So you should be always, there's some 2 or 3 investigations I recommend for every pregnant woman. Intermittently, you must do the hemogram. Hemogram, whether hemoglobin is normal, 12 to 14 gram %, or is it a 7, is it a 6, is it a 8? Dangerous. Ferrous sulfate tablets, very cheap and best tablets, you can take it. Then always check the urine routine examination. Always carefully look. Pathologists will look, you should not look. Albumin in the urine, not good. Trace albumin, okay. Trace albumin, okay. I am talking about urine, पेशाब की बात कर रहा हूं मैं. If there is a 1+, 2+, 3+, albuminuria. Oh my God, dangerous. In addition to that, hypertension, more dangerous. If in addition there is a convulsion or fever, more dangerous. Be careful. Remember these symptoms. Don't get afraid, but remember, note these symptoms, discuss with your family members and be comfortable. Okay. Then trauma, then sudden uterine decompression, short umbilical cord, or the torsion of the uterus. These are the causes in the multigravida. Okay. Now, see the symptoms. We have seen there may be revealed bleeding or there may be concealed bleeding. Can you see? Revealed abdominal discomfort or pain is there. Previously, there was in placenta previa pain, less bleeding. Here, pain is there. Okay, pain is there followed by the vaginal bleeding. So, cramp will be there and bleeding will start. Concealed bleeding, there is more pain because at least in here revealed, can you see here? The bleeding is coming out, so there is no tense inside. But here in concealed, the bleeding is inside, hidden, and it is giving the pressure on the uterine wall. So there will be more severe spasmodic pain, continuous pain without bleeding. That is the most important problem. Here in the revealed Abruptio placenta, bleeding will be dark colored. Here, blood stained serous is like a water. Serous is a water. Uterine height is proportionate to the gestational age. 7-month pregnancy, height of the abdomen at the uterus, 7 months. 8-month pregnancy, height, 8 months. So it's a very similar. In the concealed, disproportionate bulging and enlargement of the abdominal wall or the uterus will be there. In revealed bleeding, uterine feel normal, localized tender. But here, tense abdominal wall, tender, very tender. Patient will not allow, the lady will not allow, the wife will not allow. Doctor can touch the abdomen. No, not at all. And very hard, very hard, rigid. Abdominal wall will be rigid because bleeding is inside. Bleeding is inside. Then fetal parts can be identified here. But here, because already there is a lot of bleeding, difficult to work out. Okay. Then FHH, fetal heart sounds are present, but here unfortunately absent. Urine output is normal. Here urine output is diminished because pressure on the bladder. Okay, let us move further. Abruptio placenta. What Dr. Deshpande is talking about? Abruptio placenta. Okay, so treatment. First important thing, always asked that pair, couple, husband and wife, or maybe father-in-law or the mother-in-law, don't wait in the house. Shift the patient, but important is with in the hospital, but equipped maternity unit as early as possible. In the hospital, what they do with the revealed type bleeding is there. Okay, blood investigation for hemoglobin percentage, normal count 12 to 14 gram %. If hemoglobin is less than 10, mild. If it is hemoglobin is less than 7 gram %, moderate type of severity. And if it is below 6, it's a dangerous. Below 5, any time heart can stop. Just I'm warning you, I'm not afraiding you. Okay, my viewers, don't get panic. We are the doctors are here, don't worry. Why you are having the problem? BTCT, bleeding time, clotting time. Then cross-matching of the blood donor and receiver. Urine for protein, albuminuria. Intravenous, that is IV drip of ringer lactate to prevent the water and electrolyte imbalance. Okay, if patient is in labor, low rupture of the membranes and oxytocin drip can be started to accelerate the labor. If patient is not in the labor, then induction of labor by oxytocin. Okay. Now, when the bleeding is mixed or concealed type, what can be done? Normal saline or hemcil infusion can be given. then oxytocin drip for the vaginal delivery can be done. So my dear friends, looking to be the topic, it's not too difficult, but one must know that this topic is very important for your practice as well as what you can say for your examination. So this is today Dr. Deshpande has discussed that antepartum hemorrhage, that is APH, okay, and there we have seen, I am going first page. This is defined as a bleeding from or into the genital tract after 28th week of pregnancy, but before the birth of baby. Causes of APH, you should not forget: placental bleeding, unexplained bleeding, and extra placental bleeding. But the main discussion is only placenta, placenta previa. Can you see here? I will just mark for you. These points are very important: placenta previa or abruptio placenta. So, my dear friends, just make a revision of some other topics so that you will also feel more energetic. This is the end of our APH, but now I would like to remind you the another topics from the paper 1. Always there will be revision. So this 20 minutes is a revision. So which are the 10 important topics in the paper 1, which is of pregnancy, delivery and puerperial period. First, there will be Garbha Vijnani. Garbha Vijnani. Baby, Garbha. So there will be Garbhavakranti, Garbhadhana Sanskar, Garbha Sambhava Samugri, Shadadhatvatmak Purush, Garbha Hetu, Garbha Linga, Savana Vidhi. Now, this is not done to determine the sex or to make the gender male. No, not at all. It is legally not allowed. Try to understand. Huh? But Savana Vidhi can be done to get a healthy baby. Healthy and happy and what you can say, the lucky baby, then you can do the Savana Vidhi. गर्भ की मासान मासिक वृद्धि, यह है इसमें पाठ. गर्भ अवयव उत्पत्ति, गर्भ पोषण, अपरा निर्मिति, अपरा विकृति, गर्भ नाभि नाड़ी, अम्बिलिकल कॉर्ड, गर्भोदक एमनियोटिक फ्लूइड, गर्भोदक क्षय, oligo means less. Then गर्भ वर्ण, गर्भ नेत्र वर्ण, गर्भ विकृति, गर्भाशयस्थ, गर्भ क्रिया. This is all topic. First topic is related with the Garbha Vijnan. Okay, Garbha Vijnan. Vijnan is a science. Now we will discuss, or I will tell you, Garbhini Vijnan. Garbhini, pregnant lady. Garbhini means pregnant lady. So there will be Garbhini Vakhya, Garbhini Nidan Lakshana, which is called as a Vyakta Garbha Lakshana. Vyakta Garbha Lakshana. Garbhopaghatakar bhav. Very important question for examination. Garbhopaghatakar bhav, by which the lady can get abortion, miscarriage, intrauterine death, etc., etc. Garbhini Paricharya. So this is about Garbhini Vijnani. So Garbha Vijnaniya, Garbhini Vijnani. Third topic. Garbha Vyapad. This word is very common in Panchakarma. Vamana Vyapada, Virechana Vyapada. Here also, Garbha Vyapada. Vyapada is a complication. So there are totally, I can say, 6 points are there. Garbhastrav, Garbhapat, Upavishtaka, always important, Upavishtaka, Nagodar, Leena Garbha, and Mruta Garbha. Next topic is, we see Garbha Vyapad, but now Garbho Padrava. Because of the baby inside, what the lady is having, has to face the problem. Garbho Padrava, that is the Upadrava because of the baby, because of the pregnancy. So, first is a Garbho Padrava Sankhya, how many numbers? Kashyap Ukt Garbhopadrava, their management, Chikitsa. Harit Ukt, and the Garbhopadrava that we can face in the practice, medical practice. For example, Chardi. The pregnant lady is always having first 2 months vomiting, morning sickness, morning vomiting. That is called as a hyperemesis gravidarum. Oh, sir, slow. What is that? Hyperemesis. Emesis means ulti. Ulti aati hai bar, 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 bar. Gravidarum, the gravid uterus, pregnant lady is there. So, hyperemesis gravidarum in Ayurveda, Chardi. Garbhopadrava, Shoth. Edema. Edema, pedal edema, full body edema, periorbital swelling, anything can occur. Garbhopadrava, apasmar, epileptic fits. Garbhopadrava, jwara, fever can occur. Garbhopadrava, vaivarnya, anemic condition, pandu. Garbhopadrava, prameha, gestational diabetes mellitus, very common. Nowadays, very common. Gestational diabetes. Next, Garbhini Udavarta. Udavarta. Garbhopadrava Makkal. Garbhopadrava Yoni Samvarana. Bahu Apatyata or Anek Apatyata. Multiple children are there, babies are there. Garbhashayetar Garbhadhan. Garbhashayet, out of the uterus, pregnancy takes place. That is ectopic pregnancy. Ectopic pregnancy. So, again I repeat, first topic was Garbha Vijnaniya. Second was Garbhini Vijnaniya. Third was Garbha Vyapad. Fourth was Garbhopadrava. Fifth, now the time of delivery. Prasava Vijnana. Delivery, Prasava Vijnana. That means total period for that delivery. Garbhasana, position of the baby during the delivery. Prasava Hetu, what are the causes? Prasava Avastha, the different stages during the delivery. Prajayini Avastha. Avi, labor pain. Prasava Vedana. Next, now delivery. So Prasava Vyapad, what can be the complications in the delivery? So there may be Akala Prasava, premature delivery. Kalatita Prasava, after maturity, there may be delivery. Prajayini Avastha. Vilambita Prasava. Garbha Sanga. Apara Sanga. Prasavottar Yoni Bhed. Prasavottar Raktastha PPH. Next topic, our next lecture will be PPH. This is APH, now PPH. Kritrima Prasava Vidhi, artificial. Okay. Next chapter will be Sutika Vijnana, puerperial period, after delivery, after the birth of the baby. That is Sutika. Previously, 9-month Garbhini. After delivery, Sutika. Sutika. Sutika Paribhasha, definition. Sutika Kal. Sutika Paricharya Tattva. Sutika Paricharya. Just I have remembered, that is why I am giving you the important medicines which are very tonic for the after pregnancy. The viewer, my subscribers, my dear friends, please write down. Balanta Kadha number 1. Already video is there. Yes. I have made 250 videos on the Ayurvedic medicines. Very interesting. All people are very happy. They are saying, oh sir, marvelous. You are giving a very good knowledge. So that is, the playlist is Ayurvedic medicines. Know about Ayurvedic medicine. That is the name of playlist. But now I am telling you the 3 important medicines after delivery. First 10 days. Will you please write down first 10 days? बाळंत काळा नंबर 1, 10 days to 1 month. बाळंत काळा number 2, liquids are there. 4 TSF medicine, 4 TSF water, after lunch, after dinner, simple. So बाळंत काळा number 1, first 10 days. बाळंत काळा number 2, 10 days to 1 month. बाळंत काळा number 3, after 1 month. Okay. Next, we will see here what are the next topics. Next chapter is Sutika Rog. There may be some problems in the puerperial period, post-delivery. Sutika Rog Vyakhya, that is definition. What are the causes? Nidan. What are the lakshanas, sarvadic symptoms? Sutika Rog Granthukta Sankhya and classification according to the causes. Sutika Rog Sadhya Sadhyatva, whether they are Sukhasadhya, Krichrasadhya, Yapya, ya Anupakram. Prognosis of the disease. Samanya Chikitsa Sutra. Sutika Jwara. Jwara is a fever, pyrexia. Sutika Shoth, there may be edema. Then Sutika Makkal. Sutika Vidradi or Rakta Vidradi. Next topic, Moodagarbha. Moodagarbha Vyakhya, Moodagarbha Vyapti and Kal. Nidan or the Hetu of the Moodagarbha. Samprapti of that Moodagarbha. Samanya Lakshana after Moodagarbha. Prakar, types of the Moodagarbha. Trividagati of Moodagarbha. Ashtavidagati of Moodagarbha. Sadhya Sadhyatva of Moodagarbha. And Chikitsa of the Moodagarbha. Last topic is Kutumba Niyojana, family planning. I think that we have started in the Swastha Vrutta lecture. So all the classes, all the playlists, you check it and join each of the class online, Ayurveda. Family welfare concept, National Family Welfare Program in India. Then there is a family planning or the contraception or the birth control. The scope of family planning services, eligible couples, and also Ayurvedokta Garbha Nirodha. Okay. So I always try, whenever there is a time, Kshane Nashte Kuto Vidya. Dr. Deshpande don't stop the lecture before the time, and he do not continue the lecture after the time finishes. Okay. So now I am finding to tell you something about Moodagarbha. About the Moodagarbha. That is Moodha plus Garbha. Only 5 minutes. What is Moodagarbha? It is, there is obstruction or there is a stop. Garbha Gati. So whatever the tract that the fetal delivery takes place, that is get obstructed. Okay, so that is becomes the mood. It's like a or traffic jam, obstruction. Okay, so actually, when with all organs, mind and buddhi, all the fetal baby is ready to deliver, but viguna apana vayu, there is a problem with the apana vayu. There is a problem with the normal anuloma gati of the vayu, and that whole process is obstructed, and that is called as a Moodagarbha. So whenever the complete grown up, that baby inside fetus is very exceptionally, it is choked or it is blocked during the apatya patha because of the viguna apana, then that particular garbha, whichever is get obstructed, is called as a Moodagarbha. For example, after the 4th month, whenever the baby is getting ghanatva, the solidification, or akala prasava avastha, or even the normal delivery, that this type of the obstruction or the interference with the delivery process can occur, and that particular condition of the garbha is called as a Moodagarbha. So what are the causes that are described in the Sushruta Nidanasthan? Please write down Sushruta Nidanasthan. chapter number 8. And what are the causes, Nidan? Number 1, Garbhashaya Peshi Karya Vikruti. Garbhashaya means uterus, the wall of the uterus, uterine muscles, there is a problem. Actually, there should be the normal labor pains. But because of some Viruddha Ahar or the Vikrut Ahar and Vihar, then maybe because of the mental stress or Manasik Daurbalya, or maybe because of the Apana Vaigunya, that means traveling with the vehicles, then trauma, then Vishama Shayana, Vegavarod, all these causes the problem in the Apana Vayu. Another reason is a Garbha Vikruti. If the baby is having hydrocephalus, Jala Shirishaka, Ati Garbhodak, amniotic fluid is hydramnios is there. Then Garbhashe Vikruti, that is Mukhastha Apara. Just now we have seen placenta previa, Abruptio placenta, Apatya Patha Vaigundi. That means there is a Yoni Samvarna, Yoni Sraunsh, Yoni Bhraunsh. All these are causes of Muda Garbha. So, what is exactly happened? Because of the Nidana Sevan, Garbhashaya Peshi Shaithilya is there, local Vata Prakop is there, and so Garbhashaya becomes big, Garbhashaya Vyasa, Koshta Sanshobha, and Garbha Asamyak Agatam, that is Vikruta Asana. The delivery will be not normal. Okay. What are the Samanya Lakshana? Rukna Samvedya, symptoms will be Yoni Shula, genital pain will be there, Adhodara Shula, lower abdominal pain, Mutra Sanga, problem with the urination. And when the doctor will examine, he will say that there is a Garbhasana Vikruti. Presentation of the fetus is not proper. In the Yoni Parikshan, Prasava Vedana, that means labor pain, has not started yet. Proper dilatation has not taken place, and there may be placenta previa type of the symptoms. So there we can do the sonography and we can understand what is the abnormality over there. So there are the different types of Muda Garbha. Just the time is only 2 minutes. I will give you the list of the Muda Garbha, types of Muda Garbha. Can you write down types of the Muda Garbha? Number 1, Kila or Sankilaka. Kila or Sankilaka, Muda Garbha. Second, Pratikura. Pratikura. Number 3, Bijaka. Bijaka, Muda Garbha. We are talking Muda. Revision of Muda Garbha. Revision of Muda Garbha. Kila, Pratikura, Bijaka, and Pariga. Kila, Pratikura, Bijaka, and Pariga. These are the types or prakar of Muda Garbha. Trividagati. Please write down. Trividagati. That is Urdhvagati or Tiryakagati or Nyubjagati. Urdhvagati, Tiryakagati, Nyubjagati. Then there are, we will discuss it afterwards, but there is one point is called the Ashtavidagati. In the topic of Muda Garbha, there is a Ashtavidagati also. Okay. Usually, when we are talking about Chikitsa, that in the Bhava Prakash and the Yoga Ratnakar, they have given the details of it. Shastra Karma is the main part, but Ayurveda can try. It's like a trial and error. One is a Mantra Chikitsa, then Apara Patana Chikitsa, Yoni Purana, and all this doing whenever we are trying to manipulate that whole delivery process, or we want to correct the position of the fetus, then consent of the relatives or consent of the lady is very important. So my dear friends, there's sometimes that the fetus can die inside, and that is called as a Mruta Muda Garbha Chikitsa. So my dear friends, today Dr. Deshpande has discussed about APH, big topic for 40 minutes. Then he revised the topics of the paper 1, that is obstetrics, pregnancy, delivery, and post or puerperial period. Then he has discussed something about the Muda Garbha also. So thank you very much, and see you tomorrow in the next lecture of today is a Wednesday, so there will be Bala Roga, and we will complete the Bala Graha, the remaining type of the Bala Graha type of the diseases. Thank you very much. I wish all the best, but don't forget to subscribe my YouTube channel and press the bell button icon to get the notification of these type of interesting videos. Thanks.